Welcome to More Than Medicine, the podcast from Zeam Health. This show explores how integrated psychiatry, primary care, and aesthetics come together to support the whole person, not just isolated symptoms. Each episode is grounded in clinical insight, real-world care, and the latest research, helping you better understand your health and the options available to you. Whether you're navigating mental health, managing a chronic condition, or thinking about preventive or aesthetic care, this is where medicine connects. Let's get started.
Healing trauma wounds, using therapy to overcome depression. Depression often feels like an insurmountable weight, but for many individuals, it is a response to deeper wounds rooted in past trauma. Trauma can disrupt emotional, psychological, and even physical well-being, leaving scars that fuel cycles of despair. At Zeam Health and Wellness, serving Sacramento, Roseville, and Folsom, we specialize in evidence-based treatments to help individuals heal from trauma and find relief from depression. This podcast explores the relationship between trauma and depression and highlights the therapy techniques that offer hope for recovery. The connection between trauma and depression. Trauma is not a one-size-fits-all experience. It can stem from a single event, such as an accident, or long-term exposure to harm, such as abuse. A 2005 study by Briere and Spinazzola found that complex trauma, which includes repeated and interpersonal harm, often leads to more severe psychological outcomes than single-event traumas. Individuals with trauma histories frequently experience heightened risks of developing depression due to disrupted emotional regulation and ingrained feelings of shame. For trafficking victims, for instance, trauma often manifests as post-traumatic stress disorder, PTSD, anxiety, and substance abuse, according to the U.S. Department of Health and Human Services. Prolonged trauma often results in avoidance behaviors and hyperarousal symptoms, which can worsen depression. By addressing the deep-rooted impacts of trauma, therapy can help reduce depression's grip. Unpacking trauma-informed therapy principles. Trauma-informed therapy focuses on understanding and addressing the root causes of distress rather than solely treating symptoms. According to the CDC, the key principles include safety. Feeling safe is the number one priority. This means creating a space where clients feel both physically and emotionally secure. Whether it is the therapist's tone, the setting of the session, or the way boundaries are respected, safety is essential for healing. Trust and transparency. Therapy works best when clients know what to expect and feel like their therapist is being honest and clear with them. This principle is about making sure everything in the process feels open and fair, so clients can build trust with their therapist. Peer support. Sometimes, the best way to heal is by connecting with others who have been through similar struggles. Peer support helps create a sense of community and shows people they are not alone in their journey. Collaboration and mutuality. Therapy is a team effort. This principle encourages clients to be involved in their own treatment, helping them feel more in control and respected. Empowerment, voice, and choice. Trauma often takes away a person's sense of power and control. This principle focuses on giving that power back. Clients are encouraged to speak up, make choices about their care, and recognize their own strengths. Cultural, historical, and gender sensitivity. Everyone's experiences with trauma are influenced by their background and identity. This principle is about making sure therapy is inclusive and respectful of those unique factors so that every client feels understood and valued. At Zeam Health and Wellness, we apply trauma-informed approaches that acknowledge each client's unique history. Whether someone is seeking relief from depression in Sacramento, Roseville, or Folsom, our approach ensures that therapy is personalized and supportive. How therapy helps heal trauma wounds. Therapy offers a structured environment where individuals can process trauma and develop healthy coping mechanisms. Techniques such as cognitive behavioral therapy, CBT, and eye movement desensitization and reprocessing, EMDR, are well regarded for their efficacy. EMDR. EMDR significantly reduces PTSD symptoms by helping the brain reprocess traumatic memories. Participants who received EMDR therapy reported a noticeable reduction in negative self-perceptions, which directly alleviated depression. By targeting and reframing harmful beliefs, therapies like EMDR pave the way for emotional healing. TMS. Transcranial magnetic stimulation, TMS, is another powerful tool for addressing depression tied to trauma. By stimulating specific areas of the brain, TMS has been shown to regulate mood and reduce depressive symptoms. For those who have not responded to traditional therapy, TMS can be a game-changing solution. Ketamine therapy. Ketamine therapy is emerging as an innovative treatment for depression, particularly for individuals with trauma-related conditions. Unlike conventional antidepressants, ketamine works rapidly, often within hours, by targeting the brain's NMDA receptors. This mechanism helps restore neural connections damaged by stress and trauma. At Zeam Health and Wellness, we integrate ketamine therapy into our mental health services in Sacramento, Roseville, and Folsom. This treatment, combined with trauma-focused approaches, offers a holistic path to healing. The role of alternative and creative therapies. Traditional talk therapy is highly effective, but some individuals find additional relief through alternative methods that address trauma's physical and emotional effects. Somatic therapy, for example, helps release tension stored in the body, while art and music therapy provide creative outlets for processing difficult emotions. A peer-reviewed study by Brahm et al. 2017 demonstrated that somatic experiencing significantly reduced PTSD symptoms in trauma survivors. Participants also experienced fewer physical health complaints, such as headaches and stomach pain, which are often linked to chronic stress. At Zeam Health and Wellness, we value the integration of creative therapies to supplement traditional approaches. These modalities allow clients to explore healing in ways that resonate uniquely with them, empowering individuals through long-term support. Trauma recovery does not follow a linear path. It requires ongoing care and a commitment to growth. Peer support groups, mindfulness practices, and opportunities for self-expression can enhance the healing process. Zeam Health and Wellness offers tailored plans that evolve alongside each client's needs. By combining evidence-based techniques with compassionate care, we empower individuals to rebuild their lives and reclaim their sense of self. Finding hope through healing. Depression rooted in trauma can feel overwhelming, but it is not insurmountable. Through therapies like EMDR, TMS, and ketamine, along with holistic approaches, individuals can break free from the shadows of their past. At Zeam Health and Wellness, we are dedicated to guiding you on this journey. If you or a loved one is struggling with depression or trauma, do not hesitate to reach out. Together, we can explore the right treatment plan tailored to your unique needs. Contact us today to schedule a consultation at one of our locations. Healing is possible, and it starts here. In next week's episode of More Than Medicine by Zeam Health, we will discuss how online therapy supports patients managing major life transitions. Until then, have a great week.
Thanks for listening to More Than Medicine. If today's episode sparked questions about your own health or helped you understand your options more clearly, you're not alone. At Zeam Health, we provide integrated psychiatry, primary care, and aesthetic services designed to support your long-term well-being. To learn more or schedule a visit, head to zeamhealth.com. We'll be back soon with another conversation focused on care that goes beyond the surface.